Welcome back to my page, RC Medical Diagnostic Laboratory Service. I hope you enjoyed my last video on pelvic inflammatory disease. Today we are going to talk about the treatment. So before then, we are going to discuss the diagnosis of pelvic inflammatory disease. Number one is pelvic examination. Pelvic examination is usually done by doctors. So when you go to hospital or you go for laboratory diagnosis, you can request for pelvic examination. Here they will examine your reproductive organ and to make sure that there's no any sexually transmitted disease that is affecting either your fallopian tube, your uterus, your ovary. High vaginal swab. Here, a swab stick will be used to collect a sample from your reproductive organ, and then this will be analyzed by a medical laboratory scientist in the lab. So any bacteria causing infection in your reproductive organ will be isolated. Also, we have urine culture. Here, your urine will be a container will be given to you where you will produce your urine, and this will be analyzed by a medical laboratory scientist. And also, we have blood tests. We have blood tests and ultrasound. In ultrasound, the image of your reproductive system will be captured and examined. So after going for laboratory diagnosis, the organism causing the PID must have been isolated, and a particular drug which is going to treat the organism must also have been identified. So now these are the possible ways or the possible treatment that will eradicate the organism from your body or from your reproductive organ. Firstly is use of antibiotics. So once the organism has been identified in the lab, the medical laboratory scientists will do what is called sensitivity test to know a particular drug which is effective in treating the organism. So, and a particular antibiotic will be recommended for you. Use antibiotic that is not recommended by a doctor. You might, the organism might be resistant to it, and thereby causing more harm and infection in your body. So, I advise you to try to know the particular antibiotic that has been identified to treat the organism before you start taking an antibiotic. When you take antibiotic without prescription from a physician, it is called drug abuse. So the second possible treatment is treating your partner. You know, most times people treat themselves and they will not treat their partner. So this brings about reinfection. So after treating yourself, you meet with your partner, you get infected again. So once you have been confirmed that you have pelvic inflammatory disease and the organism has been isolated, please your partner should also treat him or herself. The third treatment of PID is avoiding sexual intercourse during treatment. So once you start your treatment, avoid sexual intercourse until the signs and symptoms has disappeared or when you have actually completed your treatment. This will help you to recover fast. So this is the way you can avoid getting PID. Firstly is wear protection whenever you want to have sexual intercourse. And for married couples, I advise you to make sure that once you notice any sign of infection in your body, you treat yourself, and also your partner should also treat him or herself. Number two, avoid having multiple sexual partners. Yeah, so this will also reduce the chance of you getting PID. Three, if PID runs in your lineage, try to go for pelvic examination at least once a year or twice a year. Try to be going for pelvic examination. We have come to the end of this session. Thank you for watching. Stay tuned, like our posts, share our posts. If you have any question, send us a message on WhatsApp or through Messenger. So our next lecture or session is going to be nipple discharge. That is breast milk secretion in young and unmarried ladies. The reason why it happens, the treatment, and how you can prevent it. So stay tuned, like our posts, share our posts. Thank you.